I would like to complete the presentation of my colleagues with some historical data as regards this specialty of in the University of Medicine and Pharmacy in Târgu Mureș. The dream was equally old to the dream of our colleagues in Cluj, and I like to bring to our memory one of our professors who wanted for so long to introduce this specialty. We were very happy when we succeeded to change things. Unfortunately, he's no longer with us. He has passed away, but I'm proud to remember him. After that, we had the chance to be supported by the current rector who addressed us. At that time, he was the dean who supported us, and as our teachers, as the speakers from other countries were mentioning earlier, it is very important to cooperate with people from the government, with politicians, and we later on and recently had the support of Dr. Dan, and we moved towards the establishment of master degree course of study, program of study in nutrition and dietetics. Now a few details. The same things apply as concerning the credentials. There are 3 years of study. There are 180 credits. There's 60 credits per year. Those who finish this first cycle of study have a diploma. We will have to see what to write on their diplomas as of this year. We tried to help our students to finish the second cycle of study in the Bologna system. I hope we will be able to study them, to help them continue their efforts for the doctoral degree. We had 50 places which were all occupied with enthusiasm. The first, those who finished last year, I'd like to salute them. They are most of them are in this room. From the first 50 students, 45 remained, and of these, 30 also came to the master program, filling all the places that we offered. I'd like to mention the fact that we have a very good cooperation with the pharmacy faculty. We actually started together this specialty. We're doing this together with the Faculty of Medicine and Pharmacy. And we are trying to offer information from most points of view, not only medical but also in pharmacy. I would only like to add regarding the master degree program of study of 2 years to complete the 3 years of study of nutrition and dietetics. The colleagues in pharmacy propose a more complex master's degree. As regards the assessment of the chemistry of medicine, of foods. In the master program, we didn't have such a generous offer. We offer only 30 places, of which actually all were occupied. Actually, we had 50 people registered for the 30 places, which was very honorable for us. We are happy to see an interest for this specialty, and I anticipate to fill in the 50 places of these years. We still need a signature. We want the best offer for our students, and we're trying to support them as much as we can. Also from a professional point of view, not only academic and professional. If we go hand in hand and in parallel, we can integrate them into the work market, because they deserve this. Qualification at the end of the cycle is licensed in nutrition and dietetics. Or specialized in nutrition and dietetics. We have had and we will still have discussions on this issue, also in accordance with the recommendations which appear from WHO or our colleagues from the IFAD, which is the most correct name, so that we can have cooperation and jobs in Europe and United States, not only in our country, for students who graduate here. Now, briefly, the profile of those who prepared our students. We had 11 teachers, 11 professors, 14 associate professors, 13 lecturers, 15 assistant professors, 4 tutors for each year of study, and as I said, we could count on the cooperation with our colleagues from a practical point of view. One of the deficiencies in the specialty, which I understand exists nationwide, is the practice. It is still difficult to integrate our students in a hospital to do more practice, as they say, and which they would need. We are trying to do the best we can for them, and provide them with places where they can get practical experience, which is so necessary for this profession of nutritionist and dietitian. And we have very good cooperation with the hospital, but that is not always enough. We've done a follow-up activity on our students. If I was to present a profile of the students in this year, or what will happen 2 or 3 years from now, we had students. Well, they had very different professions. Half of them already had a job and were over 40 years of age, and they fell in love with this profession and very much want to continue. Half of them were younger, and they were trying to assimilate as much as they could, and were trying to help the others. But this is exactly what made our training more interesting, because it was a higher level. We tried to have a better offer, and I think that was what counting regarding the interest later on of these students toward the master's degree and the practical activity, which was initiated here in Târgu Mureș, and I believe this counted very much. Now, in short, from those who had graduated, most of them kept their initial jobs, because there is not such a great offer on the labor market in this field. Some of them went abroad. One or two colleagues were able to get a job of dietitian in Hungary. Most of them are master's degree students, and some of them were able to find a job in areas connected with the role of dietitian. What do we desire? What do we want? We want to be able to offer them a good job. Would like to improve our activity as far as our as far as the theoretical side is involved, but also the practical side is important. We're trying to improve our equipment in our offer for our students. We are also trying to create the better, as good programs of practical activity as possible, as we can, as good as we can. We are trying to increase cooperation at the European and international level. We need cooperation so that we can we can take as much experience and knowledge, expertise and knowledge from those with whom we are working. Let me give you a brief image of the curriculum for the 3 years of license degree. So we have the food chemistry and data regarding the physiology. On the second year, we try to make it more specific as regards nutrition and dietetics. And during the last year, maybe they are the most important, the clinical subjects, to go deeper with the information. The 2 years of master's degree, we try to create continuity regarding the information received during the first 3 years, and a part of the teachers and the assistants and lecturers who are teaching were changed, so that we can try to bring something new in our field of activity. And also our colleagues also were concerned with looking at curricula from Britain, from Germany, from other countries. And as Andaloy was saying, we're trying to watch the 3 aspects, the clinical aspects, the public health and management, as much as possible. We try to cover them so that we can be able to ensure this foundation, this basis for our graduates, so that they can take various jobs which we hope they would appear. I'd like to conclude with the same invitation of cooperating with all the professional association universities around the country. I'm convinced that we will do a better job than if we work separately. And I asked them to help them with whatever they know, and to go along this road, which is quite long. And we would like to see only the beautiful part of the road. Thank you.